To everyone. So my name is Nana Kese, and I'm the Ascent Program Manager, looking at the supportive and assistive level. And I must say, it's a privilege to meet all of you virtually and to go through this discussion. What I would want us to do is not to make it dead by PowerPoint, just to make a discussion. So if you've got any question at any point, please do chip in, or you can put in a chat and we could have that discussion later. But most importantly, to also um, say a very big thank you to all of you for the work you do. And in the celebration of AHPs, I think we all deserve, well, I'm not an AHP, I'll come to that, but you all deserve a virtual applause. So if you could please do that for yourself. I'm trying to find, yes, there we go. There we go. So a little bit about my background. I'm a registered nurse and I'm currently working with TVCA as a program manager for Ascend. And we're going to get into that and what Ascend means. But today's presentation is to look at how we are empowering the supportive workforce using Ascend. And I'm sure most of you might even be asking, what does that mean? What is this Ascend? We'll get into it. So next slide, please. So for today's discussion, we're going to get to know about when we talk about Ascend, what does that mean? Who are the partners? How it even came to being? What the framework is actually about? And then we will look at the levels of practice and why should you even listen to it in the first place? Then we would summarize and look at what is currently happening within Bob ICB. Next one, please. So before we go on, just a quick let's have a quick quiz and just to get everyone awake this morning. So the first quiz is, who in the hospital can help you walk, eat, breathe, speak, and even scan your insides? Who knows the answer? You can come off mute and say it or put in a chat if you think you know the answer to this. Gianna is going to be the quiz mistress. Anyone to give it a try? Okay, so let's have the answers. See, we've got one answer and she is very right. If you were thinking it's the Avengers, you're wrong. The answer is the AHPs. Once you are for our patients, you guys do so much when it comes to the patient care, and it's only right. I think the celebration shouldn't just be for a day, it shouldn't even be for a whole month that we celebrate AHP. So we do really appreciate the work you do. Next one, please. Then the next one is, why don't radiographers play hide and seek? Who knows this? Any guesses? I'm looking at the. Yeah, Geraldine, you were close. Something to do with inside. We'll give you half a mark. Any other answers? All right, let's move on to the answer. Because they always find you in high resolution.
That's good.
And that is what our radiographers do. So yeah, there's no way you can hide from them. All right, next one. So the last one, what is a physio's favorite dance move? Who can tell us? You could put your favorite dance move in there, but that might not be the answer. It might be close. Any? Am I seeing? Okay. All right, let's get the answer. Robot. Okay. The one that gets you out of bed post op. And I'm sure when it comes to our physios, they are amazing at that. Anything to get you out of bed, we are happy about that. So that is just brain teasers for you this morning. But on to the presentation, please. So first off, we're going to look at Ascend, and when we talk about Ascend, what does that even mean, and how did it even come into being? A bit of background to it. So, in 2020, WHO reported that 1 in 2 people during their lifetime is going to suffer with cancer, and that in itself is, as gloomy as it sounds, it also means that there's a lot of work that needs to be done and there's a lot of pressure that comes onto the workforce. We also do understand from Cancer Research UK that 1 in 2, that is also going to happen. Now, having that understanding and that research being done, it makes us understand that there is something that needs to be done for the cancer workforce. I do not want the presentation to just focus on the cancer workforce, because when you look at ASCEND, which stands for the Aspirant Cancer Career and Education Development, it is a set of competencies that is put together. If you take the cancer element out of it, it fits every other workforce. So whether you are in cancer care or not, it fits. And most importantly, if you look at the research that has been done, some way, somehow, in our line of duty, we are going to come up with patients and service users who are going through cancer treatment. So you might say, well, it does not really apply to me because I'm not in cancer care. But if you look at it holistically, we care for people, even if you are in or not, we care for people living with cancer. So it's very important to get that understanding of it. And that is why this framework was put together to help the workforce prepare them and also get them to a level where we are able to provide that compassionate, excellent care we want for our patients. Next one, please. Now, Ascend was put together by Macmillan, Health Education England, and a number of these organizations. And they did that because previously, if you look at a bit of history, there were a number of competencies when it comes to cancer care, different things being done by Macmillan, Guy's Cancer Academy, Oncology Nursing UK. But they thought it's only right that it was packets of work being done. It's only right that everything is put together. And that is why that framework came about. Next one, please. So to look at the framework into details, what does it even do? What is this framework about? Firstly, it's a structured career path. So what it does is giving that structure to careers in cancer care. If you look at the supportive to assistive to pre-reg and all that, every level that you are looking at, there are framework, there are competencies that whichever level you are, it helps you to identify what your strengths are, what your weaknesses are, what the lapse in your skills and your knowledge are, then how you can be supported. Again, it's also giving you the opportunity to have that competency-based learning. They've looked at all the competencies when it comes to the care we provide and how we will be able to upskill in those skills and most importantly in our confidence. And it's also looking at addressing the evolving cancer care needs. As we know, there is a number of changes that are coming into our workforce and the things we do. It keeps evolving, it keeps changing. How are we evolving ourselves as staff? If the disease itself is evolving and we are not evolving in our skills and in our knowledge, then there is a gap in there. And that is what the framework seems look to address. And again, it's also looking at the potential of the workforce and how we celebrate. So for today, for this week, for the celebration of AHPs, ASEN also gives that celebration where people are able to map their competencies and how their career has been, and it gives you that understanding of where you are and how you can even use that to your advantage. So that is, in a nutshell, what a framework is about. On to the next one, please. Now, the framework is put into levels of practice. And when I started in this role, one of the challenges was getting people to understand the difference between levels of practice and banding. Ascend has got nothing to do with banding, so it does not really matter what band you are. What it looks out is the levels of practice. And when we say levels of practice, it's divided into the 7 levels here. So you have from the supportive to assistive, the pre-reg, the register, enhanced, advanced, and consultant levels. And at each level, there are a set of competencies. So if we are looking at we here today, we are looking at the supportive level and assistive level, and at those level, what is required of us when it comes to our skills, our knowledge, when it comes to the competence that we need to have. So people often get confused that with banding, and it dissociates itself from banding because you might be doing the same work with someone and you move to a different trust and the banding will be different. So that is why ascent dissociates itself from banding. Now it gets a bit um complex when that discussion comes about, because why should I be doing something at a different band and go to a different trust and the banding will be different? And that is why you also see seeks to address that there is that standardization. If we are looking at the supportive workforce, then there should be the streamlining when it comes to the role itself and what it requires you to do. So when you look at Ascend, you look at it in terms of levels of practice, not banding. Next one, please. Most importantly, who is the framework for? So the framework is designed for nursing and all AHPs. And that is to say, they've looked at all competencies across board. They've looked at a number of job descriptions and everything, and that has been put together to support everyone. So it does not really matter if you are an art therapist or you are a podiatrist or a dietitian or OT, whatever your profession is, as long as you fall into the category of AHP, this framework is for you. Mostly we tend to think, oh, it's nursing focused, and that is not true. It's nursing and AHP. So I hope by the end of this engagement, there is a clear understanding that, oh, we are not just focusing on nursing, but we're also focusing on AHP. Next one, please. Now, when you look at even your framework when it comes to the AHPs, if you look at nursing, if you look at other professions, there's something that is it cuts across in all of these professions, and that is the pillars of practice. So if you are looking at people in clinical care, people in leadership, in research, in education, this cuts across in every profession, and it forms a bedrock of the framework that is not just looking at people in clinical care, it's not just looking at people in research, but again, in education and leadership. As we go on with the presentation, I'm going to take you through the framework and you get that understanding of what I mean by this. It's not just, oh, I work in a community, so this does not apply to me, or I am in palliative, so this does not apply to me. Whatever be your profession, as long as, I mean, if you look at our frameworks and if you look at the competencies, the pillars of practice, cuts across, is in all of it, and that is what Ascend is all about. Next one, please. And to you being here today, I'm sure you might be thinking, what has that got to do with me? And what do I even get out of this ascent? This gentleman is talking about and disturbing us this morning with it. And this is to give you the clarity. Ascent seeks to give the clear career pathway. As I showed you previously, it comes in levels of practice. It does not mean that you only get to remain at one level. It gives you how your career could progress. And also, if you are looking at staying in that level, how you could also expand in that. So it's not just the vertical aspect of it, but also horizontal. AHPs have got wealth of experience. And sometimes we just want to be very content into what we are doing. Great. In doing that, how do we expand in it? It's not career progression. It's not always about moving on to the next one, but even in what you are doing, how do you expand in it? So once you go through the framework, it helps you to understand what you've done and what might have been in your blind side that, oh, I've not really focused on this, and it's something that I would want to look at. It gives you that autonomy to have that career conversation with your managers and your mentors. And most importantly, I mean, my previous role was a clinical practice educator, and the challenging aspect of it was during appraisal, where you get staff come to you, and mostly it's about what what can I do next? And I wish I had an answer. I always say if I knew of Ascend before now, my work would have been easier in the sense that I would just let staff go through the framework, they go through the competencies, and by so doing, it helps you to identify the gaps in your knowledge and your skills. And then we look at how we're able to support you. So it gives you that clear career pathway. Most importantly, going through it, you are then creating a competency matrix the of everything of your knowledge and your skills. If someone to come to you today that, oh, okay, show us competency wise what you're able to do, you just show them the framework and it gives the understanding. All that we are doing, we being here today, is about providing that excellent care to our patients. I mean, we look at the national patient cancer patient survey, and in the ICB, we are improving. That being said, there's still a lot more to be done. So there is always room for improvement when it comes to um, care to our patients. And by going through the framework, we upskilling ourselves, being confident in what we are doing. It ultimately gives that improved care to our patients. And most importantly, once you are able to have that clear understanding, my career when so I've only been in Oxford for a few years, and one thing that drew me to Oxford was about having the clear career pathway. Before even coming into the role, I had conversations and I knew the opportunities there. I knew where my career could go, and it's something that attracted me here. Once we are able to have that understanding and that picture of how our career could grow, it ultimately gives us that job satisfaction. And once we are satisfied in what we are doing, we tend to stay in the role that we are doing. We all would agree that if there is no job satisfaction, we tend to move. We look for the next thing. So ASCEND is giving us the opportunity to know how we are upscaling, what the lapses are, and how we can even support our patients more. And once you're able to do that to the best of our ability and get that satisfaction, it helps us. And most importantly, even if you're looking at moving, once you have that clear understanding that if I am a community therapist and maybe I'm moving from Berkshire to Oxfordshire, in that same role, I'm going to be doing the same thing and the banding is the same. It gives you the clarity and it helps you that, okay, fine, I'm not going to be doing a different thing, but in that same role, that is the same thing I'm going to do. So there is that standardization across board. So even if you are looking to move and you are able to find out that, well, if I go to this nearby trust, I'm still going to be able to do the same work I'm doing. I have that same flexibility. I mean, why would you want to go elsewhere? Well, people will still move for different reasons, but it gives the clarity and it helps to retain our workforce. Next one, please. So not to bore you with a lot of talks and presentation this morning, let's look at in a nutshell what the benefits and the impact of Ascend is. And as I've said earlier, it's looking at transforming our career development. It's giving us that autonomy to be in control of our career. Once you've gone through the framework, you do not have to be dependent on your manager or your educator for them to tell you what you need to do we know each year, I mean, around this year to around this time of the years where we start gathering the training needs analysis to see what courses people would want to do for their next tax year. And mostly is based on what the individual would want to do against the service needs. But most importantly, it's also what you would want to do because there's no point you being thrown to do a course that you are not enthused about. And mostly we get into the course before we realize that this is not what I signed up for. And that happens as a result of not even knowing what we lack in the role that we are in. By going through the framework, there is that understanding that, okay, these are my lapses, this is what I want to focus on for the next year or two. Then you're able to go to your manager, to your educators to have that conversation. Then you're also able to see, okay, how is that going to benefit the service and how can we support you? So it gives you the autonomy on your career. And most importantly, it's also to align with organizational goals. The organization has a goal and a focus. They are looking at how can we support our patients and what are we even going to look at in supporting them. So once you have the understanding and they're able to support you, they are supporting you because what you seek to do also aligns with their goals. And most importantly, is to give you the confidence. We all know that once you are much aware and you have that knowledge and skills about what you are doing, you are confident in your communication with your patients and in your assessment. And that is all that we are seeking to do. And most importantly, it's also to give us the broad view of the care we give to our patients and also of our career. As we looked at the pillars of practice, there is the clinical aspect, there's education, there's research, and there's leadership. Our career can go in diverse ways. If you go through the framework, it's not just focusing on clinical leadership, it focuses on research and education also. So it gives you a plethora of options. Okay, fine. If I'm not looking to even go in education, there is research, and that is very important. Next slide, please. So for the next steps, I'm going to talk about what we have been doing within the ICB. We are working with four trusts at the moment. So OUH, RBH, Great Western, then Buckinghamshire Healthcare Trust. And what we've been doing is collaborating with the stakeholders, engaging with the staff and the workforce. And most importantly, we've got a digital pilot going on. So when I started in this role, I'll show you in a minute. The framework was all paper based. Now we're looking at transformation in the digital space. Everything has been digitized. So we've got the framework in a digital version, and there's a pilot going on. What people are doing, what participants are doing is that what they would have done with the paper base or with the word format. Now they are doing it on an NHSE digital platform where they engage, they do the assessment and everything. And it helps to also keep everything in a centralized database. So if anyone within these four trusts I've mentioned that we are working with would be interested in participating, please do drop your name in the chat and I can have conversation with you to give you more information and also how to take things on. It started about 3 months ago, so I should say we're about halfway in, but that does not mean that we are still looking for participants. So it will be great to have conversation with you and get you involved. And most importantly, we are still socializing because the work of Ascend is broad, is huge, and we are always looking at forums to attend to talk about it and how to spread the word. Next one, please. So yeah, that brings me to um, a pit stop, I would say. Once again, thank you for listening. And if you've got any questions, let me have a look in the chat and you can also come off mute and ask your question. Thank you. Well, before you do, Gianna, if I could share my screen to take them through what the framework looks like, if you don't mind.
Absolutely. Yes. Yeah.
All right, thank you.
And then
Oh yeah,
after Amol, we will answer your question. Mhm.
well, let's take the question first.
Amol, you can ask your question. Can you put your camera on? I will.
Okay, just a second. Sorry, my camera is not working, but can you hear me?
Yes, we can.
Yeah.
Yes, we can.
So my question is where to access the accent framework? Is it
Great.
quite lengthy? Or have you got a summary if it's too lengthy?
So the framework itself is bulky, and I wouldn't put that task on anyone to go through. What I could do is I'll put a link in the chat, and that will take you to the national framework, so you could read more about it and gain the understanding. What we have done locally is to map it to the various levels. So you look at a supportive level, assistive level, all the way to consultancy level, and that was how we were working previously. Now we have the digital version. So all the participants engaged in the pilot have been enrolled onto the digital platform. But to answer your question, I'll put a link in the chat and that will take you to the framework and you could have a look at it and read more.
Oh, thank you very much. That's great. Lovely.
You're welcome. Any other questions?
I think we're going to let you place the framework first, and then after I will stop the recording to enable people to come forward and ask questions.
Great. All right, let me do that. Okay, so it's difficult when you're working on three screens. Now I can't find my mouse. Okay, where is this? All right, great. So if you can see my screen now, let me go all the way to that tab. So if you have a look here, at the top it says domain A, person-centered collaborative working. So that is helping people make informed choices as they live. And this is how it looks like. If you go to the digital platform, it might look a bit different, but this is how it looks like. So it's like the normal competencies we do. How do you provide information and advice appropriate to the needs, priorities, and concerns of individuals? So you put a brief description of what you did, how you're able to achieve that. Then you get your mentor, your assessor to sign. And that should be it. If you move on to the next one, yeah, this is also provide written or online verbal information to individuals about their condition treatment. And I'm sure we do this in our day to day. Moving on. So if you look at domain B, so domain B focuses on assessment, investigations, and diagnosis. And now it says appropriately obtain consent to physical examination, respect and maintain the patient's privacy and dignity. And this is something that we do day to day in our work. So once you've been able to achieve that, you put a description there, you get your assessor to sign, and you also assign. So it's a set of competencies that has been put together. Let me just try and yeah, you come to domain C, and it's also talking about condition management, treatment, and planning. Now, if you go down, implement shared management and personalized care. And we know when it comes to the work we do, personalized care is very important. It's all about how the patient wants to be treated and not how we want to treat the patient. It's not about what we think is right for them. What does the patient want? So that is very much focused on personalized care. And moving on to the next domain. Yeah, so domain D also talks about leadership and collaborative practice. And it says respond positively when services are under pressure, acting in responsible and considerate way to ensure safe practice. And again, we know in the landscape that we work, there is always pressure. How do we respond? So once you're able to do this, you put a description of how you're able to achieve this, and then you sign. So it's a number of it, and that is how the framework is. So you go through all of it, you get it signed. You might not have everything in there. So whatever, let's say if you've not been able to or you've never responded to any complaints, that is something to look out for. Okay, how am I able to respond to a complaint? What support can I be given to be able to achieve this competency? And by so doing, you get to build on the gaps and the gaps in your skills and your knowledge in the work you are doing. So that is what the competence is about. I'm going to stop sharing that. Any questions, please?
So I'm going to stop the recording.
All right, thank you very much.